Hi, everyone. I hope you are all doing well. I'm Dr. Roman and I'm a medical oncologist. And lately, I've been doing a lot of reading about vitamins, supplements, antioxidants. And I actually came across some information about some of these supplements or vitamins and migraines that I thought would come in handy for some of you that are suffering from this condition. So, with that being said, let's get started. And the first thing I want to let you know is that all my videos are for educational purposes only. I am not providing any medical advice. Now, with that being said, I've recently come out with two videos. The first one titled Vitamins, Do They Prevent Cancer? And a vitamin D video that I thought would come in handy and just goes over vitamins in general. And for example, vitamin D, which is often talked about, should we be taking it? Does it prevent disease? So consider checking these videos out. Now, the first thing I want to do is just go over what exactly is a migraine. And for those of you that suffer from migraines, you know this all too well. Now, a migraine is a neurological disorder causing a throbbing, moderate to severe headache, often accompanied by nausea, light and sound sensitivity, and also visual disturbances. And these migraines can be quite disabling. I mean, very bad headaches. The problem is that we really don't have a known cure. Everything is to try to reduce the attacks and try to keep the person functional or as functional as possible. And there are several treatment options that we can go over. Now, once again, the goal of treatment is to try to provide rapid relief when a person is having a migraine attack, also to try to restore the patient's ability to function, and last but not least, to try to prevent or reduce the number of attacks. Now, what treatment options do we have for migraines? Well, first of all, there are many. For example, if you're having an attack, try to remain in a dark and quiet room. This tends to reduce the amount of triggers or tries to lessen the attack. Also, sleeping. The problem is if you sleep too much or you sleep too little, both of these can trigger a migraine attack. So the whole idea is getting about a good 8 hours of sleep a day, not more than this. Also, if you're having an attack, you can either try cold compresses or warm compresses to your forehead, and they may help. Also, trying to maintain a regular diet because skipping meals can actually trigger an attack. Also, trying to avoid stress. This is a no-brainer. It's just common sense. Also, drinking caffeine sometimes may help reduce the attack. And obviously, there are several medications that we have available. For example, we have triptans, we have NSAIDs like ibuprofen and naproxen, also ergotamines, we have the CGRP antagonists. We also use anti-nausea medications like promethazine. We also use antidepressants, believe it or not. Even anti-seizure medications are used like valproic acid. We also have some of the newer agents like the CGRP monoclonal antibodies. And last but not least, even Botox has been found to help. Now, the big question is there something else? Is there another option? And that's why I'm making this video with you now, because in reading about vitamins, I actually found a little bit of information might become useful for you. So and this is all research based. Again, I'm not interested in knowing what the neighbor says or what a random video tells you. No, this is what the medical literature showed us, okay, or is showing. So there was a trial on vitamin B2, okay, which was a randomized, double-blind, placebo-controlled trial. Now, it's a small trial. It was only about 55 patients with 2 to 8 migraines per month. And the treatment was riboflavin, which is vitamin B2, versus placebo. And the results demonstrated a greater than 50% improvement in the frequency of headaches, number of headache days, and the migraine index. So overall, patients tend to improve on riboflavin versus placebo, and that's the reason I'm sharing it with you now. So the good news is that riboflavin was well tolerated, but you have to keep in mind that in this trial, the benefit was seen after 3 months of therapy. So if you're going to contemplate riboflavin or vitamin B2, you're going to have to take it for at least 3 months or more to see the benefit according to this small trial. Now, moving on, there was also another randomized double-blind placebo-controlled trial. Once again, small number of patients, 42, using CoQ10 at a dose of 100 milligrams 3 times per day versus placebo. And the results demonstrated an improvement in attack frequency, Also, reduced headache days, reduced days with nausea, and overall, the same as with vitamin B2, it was well tolerated. So, another option that I thought you should know about and consider. Also, small randomized trials have shown mixed results with magnesium. Okay, 3 trials demonstrated a benefit, which was statistically significant, but 1 trial demonstrated no benefit. So again, you take this with a grain of salt, but something for you to consider. And the dose range was 400 to 600 milligrams per day of magnesium oxide. Now remember, magnesium oxide, if you take too much of it, it can cause loose stools or diarrhea. So something for you to keep in mind and or consider. So my final thoughts, I'm trying to keep this video as brief as possible, is that if all else fails, okay, you tried all these other medications and you still have that nagging, throbbing headache and continuous migraines, ask your neurologist or your primary care doctor about these 3 possibilities, either riboflavin, 400 milligrams a day, or CoQ10, 100 milligrams 3 times a day, or the magnesium oxide, 400 to 600 milligrams a day. These can help, but remember, these were small trials. We really would need larger randomized trials to prove their benefit. So there you go. I really do hope this helps you out. Consider checking out some of my other videos, and I will see you there.